On the occasion of National Technology Day, we decided to organize a Q&A session with one of our oldest clients from the health tech industry. Mr. Smitesh Shah is the Director of Product Management at PRC Medical LLC. He is a domain expert in the health tech industry and has been involved in various large innovation continuum over the past 23 years. Let's hear his views on what technology holds for the present and future of the nation and beyond. Can you share an example of a successful health tech innovation that has made a significant impact in the industry post-pandemic?
Telemedicine is one of the successful implementation post-pandemic. Telemedicine has helped patients in rural areas as well as patients with chronic conditions. Uh, Telemedicine has been there for such a long time, but the adoption of telemedicine has picked up during the pandemic as well as has continued as steam post-pandemic. Patients in rural areas now can access or have access to better healthcare using telemedicine. Um, Not only the patients, but besides patients, the providers have also benefited a lot with telemedicine. They can now see more number of patients in shorter amount of time and give better care to the patients. The overall cost of patient care has also significantly reduced by use of telemedicine in US healthcare.
Which modern technology innovation do you think has the best use case in the healthcare industry and why?
Artificial intelligence has shown great promise in healthcare. AI can process large data quickly and accurately, which makes it a very valuable tool for researchers as well as healthcare providers. AI can be used for a variety of healthcare tasks that includes diagnosing disease, patient outcomes, as well as making personalized treatment plans. For example, AI can read medical images such as X-rays and MRIs and analyze those images and give a diagnosis which might be missed at times by a human radiologist. AI can also analyze patient information, patient history, as well as genetic information, which could give a better treatment plan for the patient to avoid future problems.
What, according to you, are some of the biggest challenges the health tech industry is facing today?
There are several challenges implementing a healthcare IT system. This includes data security and privacy, interoperability, affordability, as well as regulations. I'm going to discuss today data security and privacy, that being one of the major reasons that the healthcare IT have to spend, or healthcare tech industry have to spend huge amount of money in order to secure patient data as well as trying to make sure that appropriate security measures have been taken to avoid any cyber attacks. This has been one of the key areas in pandemic that a lot of cyber attacks have been done on healthcare IT infrastructures, and that has got a lot of attention as well as a lot of disruption in the healthcare IT, which has significantly increased the cost of maintaining and running an operation for a healthcare IT company. Interoperability is one another area where even though the standards are in place, the implementation of standards have not been adopted appropriately by the healthcare IT companies, and as a result, the data exchange between different systems has not been as effective as it could be. Due to this reason, it's getting very difficult for the patient to get a unified patient record as the data is stored in disparate systems, and interoperability not being in place or not being implemented appropriately. It makes it extremely challenging for healthcare IT providers as well as patients to get accurate information.
Can you explain how natural language processing (NLP) is being used in healthcare and how the future looks like for it?
Natural language processing has great potential in healthcare industry. NLP can be used in several different ways. One of them could be analyzing the provider's documentation from their electronic health record, and after analyzing the documentation, it can generate or suggest diagnosis code as well as a procedure code. That would be a great time saver for our billing team. This is one of the scenario, but there are several other areas where NLP could be utilized with voice assistant, as well as supporting clinical decision, as well as clinical documentation. There's several different benefits which could be achieved using NLP tools.
To conclude, let's hear from Digicorp's co-founder Mr. Nachiket Patel about his thoughts on this special day and what he feels about the advancements in modern technology that can impact the future of health tech in India.
Thank you, Smitesh ji, for enlightening us on a various innovation and challenges in US healthcare. Now, talking about India, according to a research and market report, the health tech market was valued at almost 250 billion by FY21, and it's going to grow 4x by 2027. And this shows how health tech innovation in India has shot up and has tremendous scope in years to come. Having said that, there are surely challenges in the context of India at the surface level. India is a multilingual country, and access to healthcare information is restricted at certain levels due to the language, digital literacy, and outreach barriers. For instance, digital tools will be more easily adoptable and accessible by the urban population compared to those residing in rural areas. The need here is to generate India-specific healthcare information uh, available for patients in order to strengthen the digital health ecosystem. Thankfully, in 2020, Digital Health Locker, the government of India's National Health Digital Mission, led many innovators to build an all-inclusive solution for the digital first, which is convenient, mobile, and easy to navigate. To power this, there are some impactful Indian startups like Dozy, CareMother, Ekin Care, DocPlexus, Nirmai, and Health E doing amazing work in this direction. At Digicorp for past 19 years, we are proud to have worked with passionate founders and companies who have been shaping health tech industry. Thank you.